Alrighty. I have completely kept lower salary to maintain my Cadillac healthcare as I know the amount of my benefits make up for the higher salary. You know, that's actually so interesting. I'm glad you brought that up because for many people the health benefits are absolutely that's the added plus. And we recently had an experience, Allie and I, where like that became really evident. So Allie's company recently changed their health insurance providers. And when they changed it, this is like the last 3 weeks of my life, it's been a nightmare. So when they changed health insurance providers, these health insurance providers, even though in Massachusetts it is illegal for you to deny gender affirming care, uh, because this particular United Healthcare is based out of Georgia, they have different laws in terms of how these things are applied, right? And so when we switched, when her company switched, we lost access to our gender affirming healthcare for surgeries. We have stuff scheduled. We have stuff that's coming up. This was a big fucking deal. And one of the first things that that I thought to myself was, if I was still in healthcare, this wouldn't be a problem because in healthcare you really, really do get some Cadillac health insurance. Now, there's many places in research administration I know where they're using like pretty shit healthcare and like people just do not get good healthcare. Like because they're whatever the reason the university or hospital or whatever has chosen to use like the bargain basement healthcare, and obviously those are where, you're not getting, if you're not getting a great salary and not getting great healthcare, then reach out to me and let's see if we can find you a job somewhere else where you'll get better salary and better healthcare. I would love to help you do that. Right. But, for a lot of us and me included, that Cadillac healthcare plan, it is like gold because once you, especially when you see how quickly an organization can, just take it away, right? There's something very meaningful about being a place where you're going to be taken care of in that way. That's such a, hi Scarlett, so good to see you. Oh my God, United Healthcare is the absolute worst. Oh my God, I totally named them. I absolutely named them because they're shit. They're absolute shit. Like I know they're shit and I'm not going to hide their name. And that's what I told Allie was that, this is where it starts, right? And now, like you said, not to get political, but ultimately our liberation is all tied in. So when do they decide that they're not going to cover my health care, right? When are they going to decide that they're not going to cover birth control pills? Like, when is it they're going to decide they're not going to cover whatever it is that they've decided they're not going to cover? And I don't want to be with health insurance that can immediately decide at any point in time because of their location that they can just choose to not cover me. So anyway, what we ended up doing, just as an FYI, everyone, what we ended up having to do is I run my own business. And so because I run my own business, I'm eligible to have a health insurance plan. And so now we opted out of their health insurance plan and are having to pay 20 grand out of pocket to be able to pay for our own health insurance through my company because her company got rid of the health insurance. So that's the world we live in today, everyone. Hi, this is my last week. It was super fun. Not at all. It wasn't fun at all. Not at all. Okay.